A rare and painful bone cancer is impacting teenagers. Here to share more about the signs and symptoms of osteosarcoma is medical oncologist Dr. Jonathan Metz, who specializes in the care of adolescents and young adults with sarcoma. Thanks so much for being here.
Thank you for having me.
So, doctor, tell me a little bit about osteosarcoma and who's at risk.
Yeah. So osteosarcoma is the most common cancer of bone. Overall, it's a pretty rare disease. Only about 1,000 people in the country each year will get osteosarcoma. It tends to happen in the longest bones of our body, in our arms and legs. And there's really two peaks. There's a peak in the teenage years, so patients around the ages of 14, 15, 16 and into their early 20s. And then there's a second peak in older patients, 65 and older.
So if a child is an athlete, how do they differentiate between just a regular injury and they might have this sarcoma?
Yeah, that's a great question. Osteosarcoma is a persistent and worsening pain.
Okay.
It will not get better with typical treatments such as oral medications or time. It's going to continue to progress both in pain, swelling, and eventually develop redness. We've even seen osteosarcoma tumors develop fractures if left alone long enough.
So what are some early warning signs that families, parents, even youth should be on the lookout for?
Yeah, so if we see persistent pain going on for longer than 3 to 4 weeks, especially in the areas above or below the knee or in the arm, this could be a sign of osteosarcoma, especially if there's no recent injury attached to the symptoms the patient is experiencing.
So once it's diagnosed, talk to me about the treatment protocol, because you say this is a very rare disease. So, I mean, having a specialist like yourself, people must come to the Bay Area for treatment.
Yeah, they do. So osteosarcoma is highly malignant. It's got a high potential to leave where the tumor starts and to travel to other places in the body. So for that reason, it requires a highly specialized surgeon called an orthopedic oncologist to remove the tumor itself and leave the affected part of the body with as much function afterwards as possible. And it also requires chemotherapy to decrease the chance that the tumor is going to show up somewhere else after the surgery happens.
Now, what causes it? Does a child have to be genetically predisposed?
There's a heavy rate of cancer predisposition. About 20% of patients with osteosarcoma have some sort of inherited predisposition to develop it. It could be a genetic risk that they inherited from their parents or in their families. Some families know they have that risk. Some, the osteosarcoma is the first time they're finding out that they have it. But the other 80% will be completely idiopathic. We don't know why it happened to them versus anyone else. However, we do suspect, given this age range of teenagers, and it seems like the tumors tend to occur around growth spurts, that times of really active bone lengthening and bone formation may predispose the patient to developing osteosarcoma.
Talk to me about clinical research. What's going on to get on the forefront of helping these adolescents and young adults?
Yeah. So even though it's a very rare tumor, there's a very large push to understand this disease better and to develop better treatments. So we genetically understand the changes that occur in osteosarcoma and how these cells differ from normal bone cells. We are all the time looking for additional either medical therapies or surgical treatments that can be used to enhance the patient's survival outcomes as well as their functional outcomes. And there's a whole host of new therapies, both immunotherapies and targeted agents that are currently being actively studied for patients with osteosarcoma.
Any final message for parents out there, that especially ones with these active athletic kids?
Yeah. So fortunately, this is a very rare disease. This will occur in about 1 out of every 200,000 people. So I want to assure people that almost all the time, a lump or bump or pain is not going to be osteosarcoma. However, if symptoms persist or worsen for more than 3 to 4 weeks, osteosarcoma should definitely be considered. And even a simple X-ray can be a great screening tool for looking for an osteosarcoma tumor.
All right, thank you so much, doctor. I appreciate you joining us on Bloom.
Thank you so much for having me.
All right, we're going to post this story for you on Bloom Tampa Bay, and we'll be back with more Bloom right after this.